So, with this new access to the ministers on a Thursday, I've got the Minister for Health and Social Care. Still get my head around the whole idea of getting everyone in the right slots and all that stuff.
Me too, Paul.
Mr. Hooper, I mean, you spent 5 years on the backbenches asking a lot of questions.
Mm-hmm.
I mean, that's one of your things. You're a detail man. Now you're inside this tent. What's it look like?
The same as it does from the outside, actually. So one of the interesting things about this role is that I get still to ask a lot of those questions. So the health service has been split, as you know, in April between the health department and Manx Care. So Manx Care are now the operational delivery arm. They're out there doing all the day-to-day, the frontline stuff. And really it's my job, or part of my job, to hold them accountable for the delivery. And so the job that I was doing as a backbencher for, holding government to account, really I'm still doing a lot of that work now in this role, making sure that people are getting the kind of healthcare outcomes that we expect.
So when you walked in there, was it a shock, or was everything as you thought it was going to be, or is it a big super tanker, this thing, trying to change direction?
So it is, and you've seen it with the transformation work. It's a long-term program. It's a really big piece of work. It's not going to happen quickly. But no, I don't think I've walked into any surprises, and I think that's one of the good things that we did have over the last couple of years, I suppose, was Minister Ashford at the time very happy to answer questions about anything really, and so I haven't walked into this job and opened the door and gone, what's buried under that rock or what's happening over here. Actually, a lot of it is pretty much as you'd expect, all the things you'd expect to see, issues here, issues there, challenges left and right, but actually it's a pretty good department from what I've seen so far the last couple of weeks. They're really on top of things.
Obviously, no one thing's COVID still, I suppose, is it? The situation we're in here, although compared with other places, we seem okay-ish. I don't people yelling at me on that one, but we've had our spikes here, haven't we? But how are you viewing it now? Are you fairly relaxed? I mean, you're not wearing a mask all the time, but although you might be timid?
I don't think relaxed is the right word.
No.
I think I'm quite confident as where we are in terms of the health services ability to react. Actually, they're doing a really good job. But the key message I think that we're trying to get out to people at the moment is, look, the booster programme for the vaccine is out there. We've just seen the JCVI extend the criteria to cover 40-plus-year-olds and now 16 and 17-year-olds getting a second dose as well. And the message that we're trying to get out to people is that there's a very good reason we're pushing these booster vaccines, we're advocating for them, is because we know that they help reduce the likelihood of significant illnesses or hospitalisation from COVID, and really we're encouraging people to go out and get those boosters if they are booked in, if they are eligible, if they get a letter, please turn up to your appointment. It's really the most important thing we can do, I think, to help protect the health service and try and relieve some of the pressure that we are seeing, is for people to do their part by going out and having their booster jabs.
And we are just following the UK on what they do now, on their advice, is it?
Yeah, so since day one we've always followed the JCVI advice. There have been some things where we've been able to be a little bit flexible. So the first time around, for example, the government eventually decided to vaccinate steam packet crew, slightly out of order, and that was fine back then. It was within the scope of the advice. It was something we were able to do. Unfortunately, where we are today is the advice isn't giving us that level of flexibility, so we really do have to stick with the age groups, the priority groups, and that 6-month gap between second dose and booster, but we are sticking very closely to that. And the moment the advice changes in the UK, we're probably very, very quickly on their heels over here to make sure that we are updating those criteria and getting those letters out to people pretty much straight away, really. It has to be done as quickly as we can, is my view.
And people who don't want the vaccine, what do you say? Because obviously now some countries are basically having a 2-tier system, aren't they? And potentially, if the UK did that, would we automatically follow, or would that not be the sort of thing we need to get down?
So in terms of the vaccine rollout itself, we follow the UK, we follow the JCVI. In terms of things like restrictions on travel and access to pubs and all the rest of it, that is something that's within our gift, much more so. My personal position is I've never been in favour of compulsory vaccination. It absolutely has to be a choice that people make. It's our job, I think, to give people all the information that they need to make that choice in an informed way, and that's absolutely the role we've gone down, and the direction of travel we've taken is, let's talk to people. If you've got concerns, talk to your GP, talk to the vaccination team, actually try and do what you need to do to make sure you're comfortable. But the advice that we're seeing from the medics, from the JCVI, it's very clear the vaccine is safe and effective, and we'd encourage people to take up the opportunity to have the boosters while we can.
What's the situation at Nobles Hospital now? I mean, last week or where it was, don't go unless you have to go again, and all these sort of things. And people who've been waiting for some operations are being put off again, no doubt. Where are we up to, and why are we in this situation that asking people not to turn up?
So in some ways it's quite complex, but it's also quite simple. I mean, the reason for that press release going out from Manx Care was quite simply that Nobles had seen an unusually high level of people be admitted, all sorts of reasons.
But it wasn't COVID related, was it?
It's not being directly driven by COVID, so
Right.
it isn't people being admitted with COVID, but actually, as you know, there have been lots of disruptions over the last 18 months, lots of people having to miss surgeries or maybe putting off going to have healthcare for whatever reason. There could be an element of that. Could also just be, it is a pretty bad time of year normally, and maybe we're just seeing an extra bad run, really.
Yeah.
So the situation is improving.
Well, it's very early for the winter rush to be on, isn't it? I mean,
it is absolutely, and that's definitely a concern that we have, which is why we're so strongly advocating, I think, to go and have those boosters to help make sure that whatever pressure there isn't going to be driven by COVID. So we have seen the hospital was at a stage they call Opal 3, which was about the pressure they were seeing. Now they've stepped back down to Opal 2, so they're actually in a better position now than they were. They're still seeing pressure, obviously, on the hospital and on people being admitted. That, I think, is going to be with us for a while. So what the advice Manx Care are trying to give people at the moment is have a think about where's probably the most appropriate place to go for you. So actually, if you've got an issue that you need dealing with, actually, can I get that from the pharmacist? Can I see my GP? Can I see my specialist? Rather than defaulting to hospital. But the message is still clearly very much out there that if you do need to go to hospital, please go. You will be admitted.
Yeah. Do Manx Care consult with you when they make those sort of announcements, or is it for them and within their remit just to do it and tell you afterwards almost?
Essentially, yeah. So operationally, those decisions are made by Manx Care.
They're the ones
running the hospital, but no, they will of course let us know they're doing these things because it's up to us to support them through that, and in some cases to challenge them on it and say, actually, so we're seeing this happen. Actually, are there underlying problems? Is there anything else going on that we might be able to help with? Essentially, so there's definitely a partnership working, but it's very much in their control. They're the people who are ultimately responsible for running that hospital on a day-to-day basis and making sure it's run in a safe way.
Are you worried long term for this winter that we're going to have this ongoing or on and off? Don't go this week. It's okay now again. Seesawing basically. Do you think?
I do have a bit of a concern around that, and I think we are seeing longer term pressures building up in the health service. We know we've got an ageing demographic. We know we're having issues with recruitment and the rest of it. It's not unique to the health service on the island. It's not unique to the health service. Companies all over the island are saying the same thing. But I think we are going to see these kind of pressures come and go. So it is going to be a bit seesawy. I think that's a good way of describing it. But I think the reality is we've always had that. You've always had a bit of, we're under a lot of pressure now, and then the pressure eases off. What hasn't happened in the past is we've not really told people. And so in the past, I don't think we've helped people make those decisions as much as we can do. And so the intention of Manx Care now is to be more transparent around this. So the message isn't to get people worried. If you do see these messages come out from the health service, actually it's nothing to be concerned about. It's just Manx Care trying to help manage some of that demand and trying to point people to the right place to get the right healthcare.
Have you had a chance to go around, meet people? I mean, the morale has always been an issue. Don't know where we're up to, what you thought it was like. I mean, it could be better, I'm sure you're going to say at least, nothing else. But.
Yeah, and I've started that process already, so I went round with the Chief Minister to talk to some of the ward staff. I've been up and joined a bed meeting the other week to listen on the ground some of the pressures that they're facing down at Nobles, but I've also started going out to meet GPs. I was up in my local practice the other day having a chat with one of the GPs. I'm going out to some care homes, and actually I think it's really important that I do that, because whilst all of this stuff does sit operationally within Manx Care, actually, unless you know what's really going on at the coalface, it's really hard to do the job that I'm trying to do, which is to support and help and set some of that strategic direction. So no, very much out there, and the message I'm trying to give to people is, actually, if you work in health and social care and you'd like to have a chat, if you'd like to minister and the team to come around and see what you're doing on a daily basis, just reach out, get in touch. I'm more than happy to come and talk to people.
And whistleblowing is, if people want to tell you something that's wrong, you want to hear that yourself, or do they go through the channels, or what?
I suppose it depends on what it is. There are definitely proper processes that I would encourage people to follow. If you're having employment issues, talk to industrial relations, talk to the managers. But ultimately, there is definitely a place for still talking to politicians on a confidential basis about things that are concerning. It's always going to be part of the Manx system, I think.
What can you say about the anaesthetist situation up there? I'm not sure if it's any legal issues going on. There was this issue with you're lacking anaesthetists.
Yeah, so that again, it's not a new issue in terms of staff shortages up there in relation to anaesthetists. So for a long time, I think Nobles has been operating. I think I remember being told they should have 17, and they have much less than that. It's just got a bit worse recently as they've now got fewer, I think, than they used to have. And so the problem around staff shortages, it's not a new problem. It is something that's been building for a while, and I think they are now looking to, well, actually, what can we do in terms of recruitment? How do we improve the staffing? It's a challenge, and it's because this isn't just an Isle of Man issue. So there's demand for specialists, I think, across the British Isles, and so it's not just us. We're competing, I think, with a lot of other parts of the British Isles for the same staff, and so ultimately, it's a competitive marketplace. We've got to do what we can. But no, the staffing issues are they're present, I think it's fair to say, and I know Manx Care have got a lot of different plans for how we deal with some of these issues going forward, so we're working with them really to say, actually, how can we not just fix this for today, but make sure that whatever we do is going to be sustainable longer term as well.
Just to finish with, Lawrie Hooper, the Minister, Lawrie Hooper, Liberal Van, any conflicts likely to show up? I mean, you show your hand, I know, before you joined Coleman, saying these are my principles already. Do you see any problems ahead?
Not yet, actually, is the best way of answering that. So the collective responsibility issue is a good one. I mean, I was very clear with my constituents. I don't think you need that. I don't believe in it. And so it'll be interesting to see how that does play out, I think, over the next couple of years.
Will it put you, to a test that you either have to keep your beliefs or knuckle down and go with the general consensus?
No, I don't think that's a test at all. I was very clear to my constituents that ultimately I work for them. I don't work for the Chief Minister. And so if there is a conflict that is unresolvable, if I find myself in a situation where actually I would be forced to make that decision, I've made that decision already. I'm out the door and I'm back. That's not a difficult one for me, actually.
So you're looking forward to this 5 years?
Yes, but with some trepidation, I think. There are definitely challenges ahead. And I think the reality is you've got to be awake to that. You don't walk into this job with your eyes closed. So, yes, in some ways, I'm looking forward to being able to make a difference. But equally, it's not going to be an easy 4 years.